All the action packed in 180 minutes. Power Breakfast with Tessa Dooms. Weekdays 6 to 9 a.m.
The time is 8:16. We're keeping on the question about how do we invest in the care economy and the care work in our society by focusing on Gauteng health in this segment as well. We have on the line with us Acting Chief Operating Officer at Gauteng Department of Health, Dr. Percy Mkhulu Selepe, who will just talk to us a little bit about surgeries and waiting times for surgeries. Doc, it said here that about 4,000 surgeries are awaiting, or 4,000 patients are awaiting surgeries within the Gauteng Health Department. I have a parent who uses public health only, and I remember 10 years ago when my mother was diagnosed with cancer, how important it was for her to get a surgery as soon as possible. I really believe the time frame of that surgery probably saved her life. And so when we see a number like 4,000, it does to create a lot of alarm. What is behind that?
Yeah, good morning to yourself and your listeners.
Good morning, Doc.
Let me correct. It's not 4,000, but it's 34,000, more than around 34,500 that are on the waiting list. And this waiting list is just from various hospitals in our province, the major being the tertiary hospitals and the academic hospitals. But as you've just highlighted, for instance, that the surgeries that are waiting, most of them are patients that are stable, are elective. And but as the department, we always prioritize those that are emergencies, like the cancer you have just spoken about. So these patients, they vary from different departments, which is like cataracts, your general surgery, mostly your orthopedics, then you've got your urology and your obs and gynae. But needless to say that also what is key for us with these numbers is that as the department in the previous financial year, we had managed to operate more than 160,000. That also gives us confidence that most of these 34,000 will also form part of the patients that we are going to operate in this financial year. And also, let me just also clarify something. There's a difference between a waiting list and a backlog list.
Okay.
If I go to a hospital today and the doctor says to me, you are stable, you've got a hernia, we will operate you next week Friday. I'm already on the waiting list, but my life is not yet in danger.
Okay.
I've not gone through the process whereby if it's defined in terms of a certain period to say, I have now gone beyond that period that I have not been operated. So at the moment, we do have that waiting list that we are planning to deal with. And also what I would highlight to yourself and the colleagues is that as a department, yes, we are inundated with a huge number of patients that come to seek service in our institutions, especially our academic and tertiary institutions, because those institutions are probably the centers of excellence where most of the patients, like you've said of your mother, that we operate, they come out of there alive. But also just to highlight that we also have dependencies in the department that we have to deal with on a daily basis and plan against them, which as we are dealing with them on a daily basis, I mean, part of that is that we find that we get infrastructural problems. As you know, that our infrastructure is old. But fortunately, as you've read in the media, the department has received something like 100 million, which the department is planning to refurbish the theaters in some of the facilities with about 50% of that 100 million. That would also assist us in increasing the number of theaters that we have.
So, Dr. Selepe, Over and above the infrastructure that you're talking about and theatre costs and budget that has increased for that, there is a staffing issue as well that seems to be affecting this. I know that the Minister of Health, he was talking about the national picture at the time, was saying that cuts to health budgets does mean that it's harder to deal with and fill up the vacancies that have been created in the system. How big a part of the problem is staffing when it comes to surgeries and this waiting list?
Yeah, it contributes a lot in terms of the staffing. But, on a daily basis, we get nurses resigning that are theatre trained. And you know that previously the Department of Health nationally, we were not training these specialty nurses. That makes them very difficult to find at some stage. But I would just for your I will give a scenario which we had to intervene at one of our institutions where one theatre was not working. But we had to go to a lower level institution, which is a district hospital, to say, can we get nurses from that district hospitals who are skilled in terms of dealing with the magnitude of the cases that were done at the higher level, and that we managed as well to save that situation. But nevertheless, also if we are working on also in focusing on certain departments within the Gauteng Department of Health in terms of nursing. One of them is the maternity and neonates, and the other one is the specialty nurses that are supposed to assist us in ICU and in theatre.
And is there a plan for dealing with those staffing shortages?
Yes, there is a plan. We've just also submitted to our DBG corporate in terms of the plan of nurses that we need, because the department national has also, if you remember not long ago, has promised us close to about 200,000. So we are working on terms of making sure that we then utilize that money. But also within our own fiscus, we are also reviewing how, in terms of the grants that we have, in terms of ensuring that we focus on certain departments that we've seen that really they are giving us a lot of such trouble. But also, as I've said, in terms of the waiting list for theatre, and it's that even myself or yourself, if you come to the hospital today, you are booked. You are not done immediately as an emergency. You will tomorrow form part of what is waiting, but that does not necessarily mean that your life is in danger, because we've got timelines that we put in terms of to say, for instance, if you have a cataract, therefore, for instance, your two eyes are affected. If we go beyond 60 days, therefore you are a backlog. But within that 60 days, we try to operate one of your eyes so that then you are able to have at least a vision, whilst we plan for the other eye as well.
Dr. Selepe, you keep making a distinction between life-saving surgery versus what I'm assuming are minor surgeries. But if somebody's waiting 2 years for surgery, what kind of surgery is acceptable for a waiting period of up to 2 years?
Yes, it's not acceptable that we should be waiting for 2 years. But if we look, most of those, we know those patients that are, for instance, in orthopedics, that are waiting for arthroplasty. We have a very long waiting list. But also, what keeps us with that waiting list of arthroplasty? This is a complex, long procedure that in the hands of a best orthopod that we have, even in tertiary institutions, he can only operate 4 patients a day.
So again, it's the number of skills that we have and the number of facilities that we have that is holding us back here. Because
that tertiary and upward and it needs a skill. It's not every doctor that can operate that type of a surgery, you know.
All
So
right.
in the hands of the best surgeon we have, you'll have that doctor operating 4 patients a day. That gives you 20 a week and 80 a month. And when you look at the influx on the other hand, you find that you are having 100 of influx of such. So it's also that part that says, and also those patients as well, you might find some of them, because all those knee and hip prop are usually our elderly that have got other comorbidities. They also don't just need an operation.
Yeah, it's not just one operation and then it's done. But it does seem like there's an extensive problem here, and it doesn't seem to be getting better, unfortunately. But we appreciate that you've just laid out what some of the challenges are here. Again, doubling down on the fact that we need to invest in care work. There's no better example than this one here. Dr. Percy Mkhulu, Selepe, Acting Chief Operating Officer at Gauteng Department of Health, just breaking that one down for us.